Hi, my name is Kathleen Judge, and I'm a clinical nurse specialist. Thank you so much for attending our diabetes program wellness group. We're so glad to have you. Today I have the pleasure of introducing Catherine Hu. She's a registered dietitian and a certified diabetes care and education specialist. She works in Stanford's Endocrinology Clinic and Diabetes Care Program, where she sees patients one-on-one and teaches group classes. Catherine empowers clients to achieve sustainable health goals through tailored behavior change strategies and is dedicated to providing equitable and culturally competent care. If you have any questions, please add them to the Q&A section located at the bottom of your screen. The speaker will answer your questions at the end of the talk. The webinar will be recorded and posted on the Stanford Health Library under the Diabetes Care Program. You will also find an archive of previous webinars at that site.
Great, thank you so much for the introduction. So we'll go ahead and start the presentation. So today we're talking about dietary supplements, and I'm going to go over the usage, considerations, and efficacy, and also talk a little bit about commonly marketed diabetes supplements. So outline follows. Going to go over the definition, what exactly is a supplement. I'll talk about the history of supplementation and the regulation of it in the United States. I will then talk about the safety, as well as special considerations for specific groups and supplement needs. And then lastly, I'll end with recommendations and resources. Okay, so starting with the definition, what exactly is a dietary supplement? So the FDA defines this as a product intended to supplement the diet. It is intended to be taken by mouth, and it is not intended to treat, prevent, or cure a disease or health problem. A supplement might contain one or more of the following, so vitamins, minerals, herbs, or botanicals, excluding tobacco, amino acids, or any type of concentrate, metabolite, constituent, or extract. And that could include phytochemicals, so lycopene, caffeine, isoflavones. It can also include zoochemicals such as royal jelly, creatine, things that are extracted from animals. And then other ones could be probiotics, melatonin, and glucosamine. So a little bit about the history. So in the past, it was discovered that certain vitamin and mineral deficiencies can lead to several heart consequences. So many of you probably have heard of scurvy. So that happens when there's a lack of vitamin C. They've also found that thiamine or vitamin B1 deficiency can lead to nervous system or heart issues, as well as vitamin B3 or niacin deficiency can lead to pellagra, and that results in diarrhea, dermatitis, and dementia. And then the last one I wanted to highlight was vitamin D. So a lack of vitamin D can result in rickets. So this is referring to weakened and soft bones. And in the present day, these deficiencies are a lot less common because, at least in the US, we fortify and enrich certain foods in our food industry. So there's a difference between enrichment and fortification. So food enrichment is when you replace nutrients that are lost in processing. So one example is bread. So during processing, it might lose some of its naturally occurring thiamine, niacin, riboflavin, so B vitamins, as well as iron. And then with the processing, they add these back so that we can get these nutrients. On the other hand, food fortification, this would be adding nutrients that may or may not have been naturally present in the food. So for example, adding vitamin D to milk. Otherwise, it's pretty hard to get vitamin D from the diet. You can do mushrooms, of course, sunshine, but the food industry puts vitamin D in milk to help And of course, there are a big supplement industry and development of supplements by different manufacturers. Interestingly, about a third of US adults currently take a multivitamin. And when they did a survey for customer reasons, why did you use it? The main responses were that they wanted to fill nutrient gaps and they wanted to maintain or improve their health. So as supplements are being developed, of course, they have to make some legislation about the regulation. So Congress passed in 1994 the DSHEA Act, or the Dietary Supplement Health and Education Act. And with this act, they outlined several things. So they said that the FDA will be regulating supplements as food, not drugs. And that means that the FDA does not need to establish safety and efficacy standards prior to marketing. In this act, they also specify a lot of label recommendations. So, for example, companies might put disclaimers that the supplement is not intended to diagnose, treat, cure, or prevent any disease if the label claims to improve a specific disease state or well being. And then, of course, it must include the manufacturer, packer, distributor name. It must include a supplement facts panel. And then, in order for a supplement to be banned or removed from the market, it must be proven that there is a significant or unreasonable risk of illness or injury to the FDA. So the manufacturer can go ahead and put the supplements out in the market. And then once individuals start using them, if they find that it's posing a specific risk, then they can report it to the FDA. And then the FDA will go ahead and do an investigation. But the main point is that the FDA currently does not approve the effectiveness of supplements or the contents. So it's not clear if the items that are listed on the label are actually in the bottle. And there's no mandatory formulation standards, and all the responsibility is put on the manufacturer to make sure that it's the right amount of the food product, make sure that it's a purity, make sure that there's no other things in it, as well as they can determine how much of the ingredient to put and what a serving size is. And there are a lot of supplements now, and the supplement market is quite big. So currently this year, there's an estimated $74 billion market size. And then in about 10 years, they estimate it to grow to 170 billion. So since supplements may include a lot of different levels of an ingredient, how do we make sure that we are consuming a safe amount? So I like to refer to the dietary reference intakes. So this is a set of reference values that is issued by the Food and Nutrition Board of the National Academy of Sciences, Engineering, and Medicine. And it's used to plan and assess nutrient intakes of healthy people for individuals as well as for groups. It covers four main things. So the first one is the recommended daily allowance, or the RDA. And this is the average daily intake sufficient to meet nutrient requirements of nearly all healthy individuals. There's also the tolerable upper intake level, or the UL, and this is the maximum daily intake unlikely to cause adverse health effects. And then there's also adequate intake. So this is established when there is insufficient evidence to develop an RDA, and then they give an intake that assumes to ensure nutrition adequacy. And then lastly, there is the EAR, or the estimated average requirement. And this is intake estimated to meet requirements of 50% of healthy individuals and typically used for group assessments. But I want to focus mainly on the RDA, so kind of daily intake recommendation to meet nutrient needs, as well as an upper level intake. And I've screenshotted a copy of one of the indexes here. So you can see that they give different life stages infants, children, even pregnancy and lactation, and the safe amounts or the recommended daily amounts in the first column. And then next to that, I put what their upper limits are next to that. And again, upper limits is the maximum daily intake, unlikely to cause adverse health effects, but beyond that or above that, we can't guarantee anything. And want to go over a supplement label as well. So this is a real supplement that I got the label from, and it's very interesting because you can see the percent daily value for the vitamins. A lot of them are over 100%. There's some in the 500s, in the 4000s, just a lot. And again, if we go back to the recommended daily allowance and the upper limit, these all exceed that. And there's thought that maybe for water-soluble vitamins like vitamin C, B vitamins, it's okay to take more because whatever is not absorbed or used is excreted in the urine. However, we're not quite sure. There still might be some risk with doing that. And then it's also dangerous to take fat-soluble vitamins in large quantities because they're stored in our fat and can reach toxic levels. So just something to look out for. The percent DV daily value is based on the RDA for that specific nutrient. I wanted to mention a couple of supplements that we get asked a lot of questions about in clinic. A lot of these are marketed for lowering blood sugar, improving insulin levels, helping with insulin resistance. And some of these are things like apple cider vinegar, bitter melon, chromium, vitamin C. And the bottom line is there's actually weak evidence of the benefits for certain supplements like chromium, cinnamon, berberine may help with blood sugar control, and then alpha lipoic acid might be helpful for reducing pain associated with diabetic neuropathy. However, if you look into the research, a lot of the studies have limitations on size. They differ from each other in participant characteristics, supplement formulations and dosing, length of study and results. And then in general, nutrition studies on humans is very hard to perform because it's hard to account for all the things like what they're eating, what they're drinking, what their stress level is that might influence the results as well. Wanted also to touch upon vitamin C. So we actually know that high doses of vitamin C can cause interference if you're wearing a continuous glucose monitor sensor. So that's something to look out for. If you're taking vitamin C orally, more than 500 milligrams of ascorbic acid may alter sensor readings. So that's something to keep in mind. With these supplements, again, there isn't a lot of evidence to support a beneficial effect on diabetes or its complications. And then you also want to be mindful of any side effects and then could lead to organ damage. So the American Diabetes Association releases standards of care, and their stance on supplements is that without underlying deficiency, there is no benefit from herbal or non-herbal supplementation for people with diabetes. But for special populations, including pregnant or lactating individuals, older adults, vegetarians, and people following a very low calorie or low carbohydrate diet, a multivitamin may be necessary. So here are some of the special considerations more in detail. So pregnancy is a big one. You're growing a child and you need more of certain nutrients. For example, folic acid is important for preventing neural tube defects. Also higher needs for iron, calcium, vitamin D, choline, and omega-3 fatty acids. For vegans, they might be at risk for vitamin B12 deficiency, zinc, iron, as well as calcium and vitamin D, if not eating dairy products. And older adults, especially those over 50, have been found to have reduced hydrochloric acid production in their stomach, which is needed to help absorb B12. So that could potentially be supplemented. For bone health, osteopenia, osteoporosis, calcium, vitamin D, and magnesium. For high triglycerides, sometimes omega-3 fatty acids are recommended. And then also for age-related macular degeneration, there have been studies that have found that vitamin C, E, lutein, zeaxanthin, zinc, and copper could be helpful for slowing down macular degeneration. So if you choose to take a supplement, or if you are recommended to take a supplement by a medical provider, these are things I recommend to look for when looking at which supplement to choose, to make sure that you're getting a pure substance, to make sure that you're getting what the label says you're going to get, and then also just to make sure that it's safe. So you may have seen these labels on different bottles before. So the leftmost one is the US Pharmacopoeia. There's the National Science Foundation International as well. And then there's also Consumer Lab. So these are all different independent third-party testing organizations. And with these labels, they can certify that what is on the label is in the body. And some of them do toxicology reviews to make sure that there aren't any other things in it. And then also does purity and amounts. However, these do not test for efficacy, just the purity and the amount and making sure the ingredients are what they purport to be. So if you're wondering if you should take a supplement or a multivitamin, I would recommend working with a medical provider or a dietitian and seeing if you really are lacking certain nutrients, or if you have a lab test and you are deficient in something. But otherwise, we recommend getting your nutrients from whole foods when it's available and when you can. So these are examples of fruits, veggies, whole grains, legumes, nuts and seeds, lean meats, and fatty fish. And there are benefits that you get from these foods that you may not get from supplements. So for example, a lot of these foods have fiber in them. They have the vitamin and minerals in them already. And usually, especially different colored produce, have different phytonutrients that confer different benefits, such as antioxidant ability. Because these foods have more fiber and more volume, they will also provide more satiety. And then lastly, you are not able to taste a supplement. Well, sometimes you are, but maybe not the food product itself. So you're also missing that as well. So in conclusion, recommend always consulting a medical provider to see if you do need supplementation or if you have specific questions about one. And then know that supplements are not replacements for diet. And also just checking the label and be wary of certain claims, like if it says natural diabetes cure or if it says replace your diabetes medicine, just understand that these claims are not regulated and can lead you astray. For supplements that you are taking, make sure that they have the third-party independent testing lab label. And then for more information about diabetes-related supplement information and where I got the bottom line about those different supplements, the NIH has the National Center for Complementary and Integrative Health, and they go through every single supplement that has been marketed for improving blood sugars, and they talk about the different studies and how they come to the conclusion. So I thought that was a really good resource. And that is all. Thank you everyone for listening. I'm happy to take questions now.
Thank you so much, Catherine, for the presentation. And we have a couple of questions in the chat, so I'm going to scroll through them. In terms of overall health, you had talked about food versus vitamin supplementation. In your opinion, is it better to eat certain foods in its entirety for achieving vitamin and mineral health, or is it better to take a supplement?
Good question. I would always say, because I'm a dietitian, go with the food first, just because the food is already packaged with those vitamins and minerals. It has the fiber that usually supplements cannot provide unless you're taking a fiber supplement. And then also the phytochemicals that confer certain benefits that you may not get from a supplement.
Okay, thank you so much. The next question is regarding the, when you talked about using the CGM for vitamin C, can you have foods that are high in vitamin C? I know you mentioned supplementation at 500 milligrams would be too much, but what about foods that are high in vitamin C?
Hmm. That's a good question. I actually don't know the answer to that. I would suspect that it could because you're intaking vitamin C just in food form. It's just a lot harder to get to that point, the amount that you would get in a supplement. So it's less likely, but it could be if you're consuming very high intakes of vitamin C. It's just like when you consume a lot of carrots, the beta carotene may turn your skin orangey yellow. But you need to eat a lot of carrots to get there.
Got it. Thank you so much. That's excellent. That really seems to be a lot about the questions that I'm moderating in the chat. Any parting words for us, Catherine?
So I would say, yeah. So again, choosing foods more often. For supplements, if you choose to use one, make sure that you consult a medical provider. And then for any supplements, make sure to look at the label and research if it's tested to make sure that you're getting a pure substance.
Okay, thank you. And thanks for everyone for attending, and an absolute big thank you to our speaker, Catherine, for the engaging talk. The recording will be posted next week at the Health Library under Lectures and Events and under the Diabetes Care Program. We'll see you next month. It's the second Thursday of the month at 5 p.m. And the topic will be how to keep your heart healthy.